Thank you everybody for coming here. I hope you can hear me okay. I'm just gonna get started. We talked a lot about medical school, so I think we need to change gears and start talking about nursing school because I love nursing and I love nurses. I just wanted to mention that I have an interpreting team right here. There's 3 interpreters. So they're for me, but they're also for the audience. So anybody that is deaf or hard of hearing or needs an interpreter can use our interpreter today because I believe in being fully accessible with all my presentations. Alright? So who am I? So Marie gave me a very nice introduction. So I actually graduated in June from my residency program in Saginaw, and now I'm a full-time nurse practitioner in primary care at the Saginaw VA. All of my patients are veterans, and they're a really special population. And I say that because they were in the military, they made many sacrifices for us, for our freedom and democracy, but they've also come back to us and they have disabilities as well. So there's a lot of veterans that have hearing loss, or they're in wheelchairs, or they have low vision. So it's a very interesting population. So you can see all of my educational background. And I'm also a dog mom, so that's my dog right there. He keeps me grounded when I'm having bad days. And I'm also involved in many organizations because I don't know how to say no, so I'm always involved in something. So I just wanted to talk about goals for today. We're going to learn about a deaf and hard of hearing student's journey through and out of nursing school. We'll talk about accommodations and tools to help these students. And then we'll also talk about legal stuff as well. I'm not a lawyer, I'm a nurse practitioner, so I'm not versed in all these laws. I'm just going to give you an overview. So this is kind of an outline of what we're going to do today. I'll lecture for about 40 minutes. I think that's a good, limit on a person talking because sometimes you get sick of people talking. Then we're going to work on some case studies together where you can interact with each other and kind of get to know each other and learn different ideas. And then I'll leave at the end for a question and answer session. So I ask that you hold all your questions to the end so that I can use my interpreter so that I can understand what you're asking, okay? So I wanted to start with some terms that we've talked about in some of the other lectures. So the first one is ableism. We heard about that one in the North-South presentation. And I got both of these definitions from Detroit Disability Power, which is a really awesome organization in Detroit. So ableism is discrimination or oppression against people with disabilities. And if you want to go on a deeper level for people who have hearing loss, you talk about autism. So it's discrimination against a person with a hearing loss. So I've experienced both of these. So now I'm going to talk about the different paths in nursing. Obviously, nursing is a very broad field, and there's different ways that you can get into nursing. It's not like medical school where you go to medical school, you become a doctor, and then you do your residency and you do that. Nursing, there's different ways that you can get started. So the furthest left over here is a CNA, so Certified Nursing Assistant. So that's probably like the lowest level that you can start at. And I don't like saying lower. They're very, very, very valuable. I really appreciate all my nursing assistants because they do a lot of things for me so that I have the time to do other things. So with the Certified Nursing Assistant, I believe you go to school for, I think, 8 to 12 months, and then you take a certification exam. And then you become a nurse assistant and you can work in a hospital, a nursing home, or whatnot. Then if you move to the right, you have LPN. So this one is kind of being phased out. Like not all the hospitals are using LPNs anymore. it used to be in the past that you could get like a nursing diploma at a hospital, and then you could become an LPN, and then you would work in the hospital. But now, hospitals want to have an RMDS time. So they want people to have a bachelor's degree because they feel that you have more knowledge and education as a nurse if you do the RMDS time. So I'm not sure like what the timeline is, but they were saying that it was going to be 2020, but then that didn't happen. So I think it really depends on the hospital and the healthcare system. At the VA, they do have LPN, so I have LPNs that work with me. But when I was working at different hospitals in the Detroit area, we did not have LPNs. I never saw LPN. I didn't know what an LPN was. So the registered nurse and the LPN, you both have to take a licensing exam with the state. So it's a board exam with the state. However, the licensing exam is a national exam, so it's going to be the same exam across the whole country, but the state board administers it. So I think that's kind of confusing. It's different with medical school because it's more national, and I think the national level, but the state board administers the nursing exam, but it's still a national exam. I think that's kind of confusing, but I hope you get it. So, as far as accommodation for, if you want accommodation for the licensing exam, you go to the state board, you don't go to the national board. So I actually went to my state board in Michigan and I said, hey, can I have accommodation? And they were like, sure. So they just gave me whatever I wanted. So it depends on your state. So different states might say no, and different states might say sure. So the student would have to ask the state if the state offers accommodation for any of these exams. Then we're going to move on to the NP, the CRNA, CNS, and nurse educator. So I put all these together because these are all master's level or a doctorate level. So I'm sure everybody here doesn't know what all these mean, so I'll break it down for you. So a nurse practitioner, like me, is like a provider. So almost like a doctor. You can prescribe medication, you can see patients, you can run a clinic, whatnot. Then you have a CRNA, which is a registered nurse anesthesiologist. So basically, this person will be in the operating room giving anesthesia. So you probably see a lot of CRNAs in the hospital, and they work in the hospital. So they go through a lot of training. It's very hard to get into this program, but a lot of people enjoy it. Then you have a CNS, which is a clinical nurse specialist. So these people, like, they focus more and specialize. They work a lot on preventative care, so they might focus like on something in community health, and they work with patients in that specific area. So they might see patients, but it might need more education. So it's kind of hard to explain that one. The nurse practitioner solely sees patients, but the clinical nurse specialist might see patients, so they might be more educated. Then you have a nurse educator right on the end, and the nurse educator, they can work in a hospital, they can work in nursing homes, they can work in clinics. Basically, their job is to educate their fellow nurses. So they teach them different protocols or different policies, and then they can also come up with, like, the education package that we give our patients. So the nurse educator works on those packets and help make it make sense so the patient actually understands what it means. So they have a really important job. So I just want to summarize it. So we start with a certificate, then we go to a license and a BA, or you can get your associate's degree. Then you move to the master's and doctorate level. So there's different pathways. Some people go all the way and get everything. Some people just want to be nurse assistant. So it's really up to your student what they want to do, but just make sure that they're aware of how far they can go in that field. So some of the challenges entering the nursing field as a person with hearing loss. So a lot of the pre-nursing jobs are inaccessible, so meaning they don't have interpreters, or they don't have a phone that works for them, or they don't have a stethoscope that works for them. A lot of shadowing and volunteering experiences are also inaccessible. So let's say that my interpreter over here, she really wants to go to medical school, she's hearing. She's gonna go find some doctor that works at her hospital and she can go shadow him, no problem, because she doesn't need accommodation. But for me, I had to find someone that was willing to work with me and my disability. So I don't personally use interpreters when I work at work, but there's some deaf and hard of hearing people that do require interpreters. So if you're trying to shadow a hearing person and you don't have an interpreter, then that experience is not very valuable. And then the last point on this slide is deaf and hard of hearing people are often not encouraged to enter these fields because of their disability. So when I was in college at the University of Michigan, I actually wanted to go to medical school, and my academic advisor told me that she didn't believe that I should go to medical school because of my disability, and she tried to guide me into the research field. So that's actually why I have my degree in neuroscience. So I went to Chicago and I thought I was going to get my doctorate and PhD in neuroscience and become a hotshot researcher. But then it was in my gut, I didn't feel like that was where I wanted to be. So then I ended up moving back to Michigan and I went to nursing school. So unfortunately, I listened to people telling me that I couldn't do it. So I'm hoping that all of you are able to tell your students that they can do it and they can get into this field. So I really like this slide and I use it in probably all of my presentations. So a lot of people think that people that are successful, you just go on a straight line, okay? So you get there. The squibbly line is pretty much my life. So I said that I was trying to go to medical school. I got pushed into research. It wasn't what I wanted. I turned around and I changed my career and I went into nursing. So I like this a lot because I feel like people with disabilities do the squiggly line because they have people tell them like they can't do it, but they still want to do it, and they find a way to do it. So they might become successful and they're trying to get into the field and then someone pushes them back, but then they keep going, but then someone pushes them back. So I think this is a really good picture. So I just wanted to talk about how to prepare for a nursing career. Obviously, it's a very stressful career and school can be very stressful. So there's different ways that you can get ready to go to nursing school. So the first one is volunteer in the medical field. So there's different ways that you can volunteer. You can go to your local fire department or EMTs and you can ask if you can help with the event. You can go to a hospital and see if you can help with any event that they have, maybe help at a blood drive. So I know that I'm saying volunteer, but I said previously that sometimes there's inaccessibility. You just have to meet people that are open-minded and willing to work with you. And then shadow a medical professional. So I am a board member of AMPHL, so Association of Medical Professionals with Hearing Loss. We have a mentorship list. So if you have a deaf and hard of hearing student, they can sign up on the website for a mentor. And I'm actually a mentor, and the student can choose to email us or call us or text us and just get to know more about our journey, and we can give them advice too. If you have someone that lives in your area, so I live in Michigan, and I've had several students approach me and ask if they could shadow me. So if you can find someone in your state that's deaf and hard of hearing in the nursing field, go try to shadow them. It would be very valuable. and then also attend conferences and webinars in the medical field. So obviously I know a lot of webinars and conferences may be inaccessible, but I highly encourage people to go to the ANFO conference. That's going to be in August this year. We'll have another one in 2024. We also have the Deaf Health Talk that was on once a month, and I actually participate in that with the University of Michigan. So that's another way that people can get involved. You can always, like if there's a webinar or conference that you're interested in, you can ask for accommodation, you can ask for captioning, you can see if they offer an interpreter. I mean, it doesn't hurt to try. And then you want to learn more about leadership and advocacy. And I feel like this is very important because when I was staying with my own career, people told me no, but then I decided that I wanted to be a nurse, this is what I wanted to do. So what I had to do is I had to learn how to advocate for myself. And I had to learn about the laws, and I had to learn about my rights, and learn about what I could do so that I could get where I wanted to be. Okay, so let's say that you have a student that wants to get ready for nursing school. How can they get ready? So like this would be like, maybe they're fresh out of high school and they want to go to college and they know that they want to go to a nursing program. Or let's say that they're a sophomore in college and they want to join the nursing program. So this is what we would talk about. I should mention that there's two different ways with the RN and LPN. So at community college, you can get your associate's degree and then you can get your RN. And this is usually a 2-year program. You have to do all your prerequisites before you get into the nursing program. So that's true if you get your bachelor's or your associate. So if you're going to the community college, you're actually probably doing 3 years instead of 2 years because you have to do at least 1 year prerequisite to get into the nursing program at the community college. If you're doing your bachelor's, usually that's a 4-year program. So you spend your first 2 years, you're doing like all your general requirements, and then you're doing your prerequisites like anatomy, you have physiology, you have biochemistry. So you need to get those classes out of the way. And then your last 2 years, so you would apply for your nursing program at the end of your sophomore year, and then you would start the nursing program in your junior year. And then when you're in the nursing program, it's just nursing class. It's not anatomy, you're done with that. You're done with biochemistry, it's just nursing. So you learn everything related to the nursing. So prerequisite courses, you can take these anywhere. I actually did my prerequisites at a community college, and then I went to the university for my nursing school. It's really important to pick a good nursing school. So you want the nursing school to be accredited, so obviously a good school and they're accredited. But you also want them to be open-minded. So I went to Detroit Mercy for my nursing school. I was the first deaf person in the nursing program, so they had no idea what was going on. But they were open-minded about it. They were happy to learn. They were happy to help me and give me what I needed. So I say that deaf and hard of hearing students should look around and they should see what other deaf and hard of hearing people went to nursing school, because that shows that that school is open-minded, they're willing to accommodate, they're willing to help that student. And then you want to pick the right kind of program. So I talked about the different paths that you can take into nursing. So you have to decide what path you want to take. Some people just want to be a nurse assistant, and that's what they want to do. Some people want to go all the way to MP. So you have to figure out how that's going to work in the long run. You might not have it all figured out right now, but you have like a general idea. Then you want to research accommodation. So you have to decide like what works for you. So not every deaf or hard of hearing person has interpreters. So when I was in college, I never used interpreters. I didn't learn sign language until I was in college, but some people want interpreters. Some people like the captioning with the color. Some people like note takers, some people like the FM system. So you have to find what works for you and what works for the class. I'm just gonna get some general advice from what works for me and what works for several other people. Is if a student has a lab class or a simulation class where the professor is walking back and forth, it might be helpful to have an interpreter because the captioning person can't take their captioning machine and walk back and forth. But if you have an interpreter, they're able to move. So that's just one thing that I learned. And then obviously you have to learn how to be your own advocate. Sometimes you're going to be the only deaf and hard of hearing person there. And it's going to be lonely and you'll have people telling you that you can't do it, but you have to stay strong and you have to say that you can do it. So, nursing school is broken up into two parts. You have a theory and then you have a practicum. So I'm going to start with the theory. So the theory is the classes where you go to the lecture, you might have small group discussion, sometimes it's like hands-on where you do simulation. So that's all like classroom learning. I have to mention that in nursing school, like medical school, you have very technical language. So you want to make sure that your interpreter or your captioning person has the vocabulary before they start the class. Otherwise, they might be scrambling to keep up because they don't know how to say the words or spell the words. Because if you're taking an anatomy class and they're talking about this muscle here, which is, I can't even pronounce it, it might be hard for your captioner who's never heard of it before to spell it for you. So you want to make sure that you prepare your team. And then it's also important to know that nursing school is very fast-paced. It moves very fast. It doesn't slow down. So you have to keep up with the staff. You're going to have several lecturers, so you're not going to have just one professor all the time. So you might have this professor for this class, and then you have 4 professors for this class over here, and then this class has 2 professors, so it's always changing. And then I was talking about skill classes. So skill classes are when we go into, at least at my school, it was like a mock hospital room with several beds, and then you break up into groups, and you learn different skills, like how to put a catheter in, how to put tubes down, and stuff like that. So you're working in a small group, and you're learning how to do the different skills that you're going to do in the hospital. And then they strongly encourage study groups. So you're not just doing the skill classes, you're not just doing the lectures, you're in the group studying. So you may want to have your interpreter go with you to the small group so that you can study with other people in your class. And then nursing school is very complicated. We have exams. They usually for nursing school are multiple choice because our national exam is multiple choice. So I know that that can be tough with people with disabilities, especially for deaf and hard of hearing people. If their first language is sign language, then reading a multiple choice exam may be difficult to them because they don't understand like how the questions are broken down. So I've had some people that are like fully deaf and use sign language go to the state board and ask for accommodations on their exam. I don't know if they've been successful, but they've asked if they could have an interpreter sign the question to them. The interpreter was not allowed to, like give them hints. They could only translate what was on the paper. So I don't know if it was successful with that, but I'm told that they've done it for nursing school and then other licenses, like hairstyling or whatever. So that would be a good idea to ask the state nursing board if they could do that for a deaf person that uses sign language as their first language. Another thing that we do a lot is papers. so I have to write a lot of papers. And check-off. So check-off will be in the school classes. So what you have to do is you have your mannequin, and then you have to demonstrate your skill. It's very nerve-wracking. Every nursing student hates it. But you have to stand in front of your professor, and you have to talk, and you have to say what you're doing. And then you also have to be like, "Hi, patient Bob. My name is so-and-so. I'm going to be your patient today." So you have to demonstrate how you would interact with your patient while you're doing the skill. So this can be very stressful. I do recommend that if a student needs an interpreter or they need captioning or whatever, to have that set up so the student is not so stressed when they're doing the check-off, because that way they can understand what the professor is asking them to do, and then they can just do it. Okay, so now we're going to move on to the other side of nursing school, so the practicum. So in nursing school, you generally do, I want to say, about 5 clinical rotations. It depends on what school the student goes to, but you will rotate in different departments. It's usually done at the hospital, or some health center. So my school is a Catholic school, so we had to do community health. So we had to go out in the community and we did something in the community. In the hospital, it can be kind of messy because you ask if a student has an interpreter, for example, you have to get approval from the hospital and the school for the interpreter to go to the hospital. So some hospitals might be put off by this, and if they're going to give you a lot of difficulty for that student, maybe just move that student to a different hospital that's more open-minded. So when I was in nursing school, my program knew fully that I had a hearing loss. I didn't take an interpreter or anything with me, but they knew that I had to have a preceptor that was guiding me, that understood that I needed read lips and I needed help, understanding once in a while. And they tried to put me at specific hospitals and specific floors in the hospital where they would be more open-minded. So if the student's able to work with their program directors and you find a really good preceptor, a really good hospital, then it will work really good. So the preceptor is usually like your guide. So they take you to the hospital, they tell you what you're going to do, but they may not be with you all the time. So in your first semester, when you do your clinical, you're going to be with your preceptor most of the time. So the preceptor will take you, and it's usually a group of probably 4 to 8 students, depending on how big the program is, with the one preceptor. And in the first semester, they usually take you as a group to meet the patient, show you different skills, and try to get your feet wet. When you get to your last semester of nursing school, you're usually one-on-one with the preceptor. So I like that a lot better than being in a group because I could just talk to my preceptor. The other thing I wrote on here is that you might work with the staff nurses, so staff nurses that work at the hospital, so your preceptor might say, today you're going to go work with Sally over here. So you should make sure that the preceptor knows the nurses on the floor and she knows who's more open-minded and willing to work with that person with a disability. And then I already talked about the immersion, and as far as challenges, we talked about the interpreter challenge because some hospitals might challenge the interpreter, especially with COVID. I graduated nursing school in 2015, so I don't know what happened during COVID with the accommodations and interpreters and whatnot. So I'm not sure how it works now, so you might have to investigate how that works, especially if they make you wear masks. You can see if a hospital has clear masks, or the school can choose to purchase clear masks for that student, so the student can take it to the hospital and they can have a clear mask so that they can understand the interpreter or they can live with their preceptor. So what do you do after nursing school? So there's many ways that you can enter the workforce. Like I said, you can work in nursing homes, you can work in hospital, you can work in outpatient clinic, you can work in employee health, you can do, some people work in, I'm from the Detroit area, so we have nurses that actually work for the electric company, or they work for the car company. So they go and work for the car company to make sure that the employees are safe. So that's another option if you want to work in that. And then the second line is really important. So it's a really big choice for that person if they want to disclose or not. So when I graduated from nursing school, I did not disclose. I did not tell them I had a disability. I told them I was just a normal person. And the reason I did that was I heard a lot from other people because I asked around and I asked different hard of hearing and deaf people, did you disclose or not? And a lot of people said that when they told the hospital or whatever that they had a hearing loss, they didn't get the job. So I chose not to disclose and I ended up getting a job and I was successful. But obviously now people in the Detroit area and up in the VA, they know me. So I can't hide it anymore. They know I have a hearing loss because they like to publish me a lot. They like to put me in newsletters, so my name's out there. I can't hide it anymore. So that's a really big decision for the student to decide if they want to disclose or not. Some people are deaf and proud, they want to say that they have it. Some people feel like they have a better chance to just hide it and then tell people later. I just want to say that I did not disclose, I did not tell them that I had a hearing loss, but after I signed the paper and my ink was on the paper, I was like, hey, I'm gonna need a clear map. And they were like, I didn't know you had a disability. I'm like, yeah, I have a disability. So then they were forced to give me what I needed because I signed the papers. If you sign the papers and you have a job and you signed off on everything, then they're legally obligated to accommodate you at that point. If, let's say, you have your interview, they offer you the job, but you haven't signed the papers, that can be kind of a gray area, and they can still be like, nah, we don't want it, if you try to say, I have a hearing loss. So, timing is all about timing and your comfort level. Asking for accommodation. So, for me, I prefer, well, in the beginning, now I just tell them right away what I need, but in the beginning, after you sign the paper, it would be important to find your ADA person at the hospital. Not all hospitals have an ADA person, so you might have to go through HR. Some hospitals, it might be with IT for some reason. It's weird. But you just have to find that person to help you with the accommodation. So one of my accommodations is I use a smartphone for my phone calls, so I had to go through IT for that. And I had to go through the privacy officer. And then there was the whole HIPAA thing. And then we went to the legal team. So I met a lot of people in the hospital with that. And then the last part is, as a nurse, you have to do continuing education. So this is like webinars, or you do modules. So you have to do so many hours. It depends on your state. So the state of Michigan requires 25 hours every 2 years. So there's so many modules, so many webinars out there. So if you find one that's inaccessible, you can just find something else. And a lot of hospitals offer the modules and CU in the hospital, so you can get them done in the hospital and you don't have to go outside the hospital to do your education. Okay, so we graduated from college, when we took our licensing exam, we passed, yay. We're gonna take our first nursing job. So when you have your first nursing job, you might face a lot of doubt from your peers, your employers, like, how are you gonna hear the alarm? how are you gonna, what kind of stethoscope are you gonna use? What about the phone? What are you gonna do about the phone? So I really recommend that you do your research and figure out what works for you and what works for other people so that you can take this research to the hospital and be like, hey, I found these 4 stethoscopes that I can use. I'm gonna buy this one because it works best for me. Or I found this app on my phone and I work with IT and we can connect it to the hospital phone where you can forward a phone call to my smartphone where I can have captions. If you're able to provide that information in the hospital, then they feel like more relief and they feel like that they can help you. Because if you don't do your research and you show them different resources, they're really clueless and they get really like antsy about it. So if you're able to do research, it will help them a lot. Obviously, you need to keep standing your ground and advocate for yourself. So when I was in my first year of nursing, I was working at Beaumont Hospital in the Detroit area, very big hospital, very famous. They wanted me to use the crappy little hospital phone, and they actually forced me to use that phone for about 4 months. And they tried different things where they gave me headphones and turning up the volume, and it was just awful. I had doctors screaming at me on the phone, and I kept telling them, this doesn't work, I found this option. And they kept saying, no, you need to keep trying what we got. So the important lesson is that I didn't give up on what I wanted. I kept telling them that this is gonna work. So they finally came around to the fact that we needed to get the smartphone and we needed to connect that. And it's really important to just stand your ground and say, this is what I need. Even though they keep telling you to do something else, what I learned in that is try it and you can prove that it doesn't work and you take it back to them and say, let's do this. You also need to know your legal rights. So make sure that you're researching the laws and you know your rights as a person with a disability and you're able to just bring it up in conversation and say, well, the ADA law says blah, blah, blah. I find that every time I'm in the workplace or I'm somewhere where they're trying to discriminate against me and I say the ADA, they all go like, and they back off. You also want to look for disability-friendly health centers, like Rex, where Marie is working right now. University of Michigan is another great one. I don't know anywhere else. Sorry. You also want to find allies at your job. So find people that work at your health system that are supportive of you. Find people that you can go to if you're having a hard day and need help with that support and finding that resource. So now we talked a lot about undergraduate nursing, so I think you guys kind of understand the whole undergraduate nursing. Now we're going to move into graduate nursing, so this would be like a master's degree or a doctorate. I've already went through the different positions that you can get into. So each one of these you can get either a master's or a doctorate. But it depends on like how far you want to go in that field to if you need a master's or a doctorate. For nurse practitioner, which I am, I only have a master's degree right now because if I was to get a doctorate, they would expect me to do more research like papers and more hospital administration. So I prefer to be with my patient and not with the administration. So becoming a provider or a specialist, it can be a very stressful job because you're thrust into that leadership position. So as a nurse, like an RN or an LPN or a nurse assistant, you follow orders from a doctor or the provider. So you don't really have a voice. You're kind of doing what you're ordered to do. As a provider, you're the one that's giving the orders. You're giving the people what they need to do. So there's different paths that you can take. I was talking about some people like to go into administration. So some people might become a nurse practitioner, but they decide they want to go into administration because they want to change the way that the hospital works. So let's say I'm a nurse practitioner. I'm very passionate about people with disabilities. I'm going to go into administration to change the policies at the hospital so that we treat our patients with disabilities better. So that's a way that you can get into it. Some people just want to take patients. Some people don't like the paperwork, they don't like the policy, so they just do patients. And then some people just like educating. So they get their nursing degree, they get their master's degree, but they don't want to see patients, they don't want to do the paperwork, they just want to teach. So they teach like the staff at the hospital, like different procedures, or let's say there's a MRSA infection. So this is going to be a new policy for how we treat a MRSA infection. And then obviously as a provider specialist, you have leadership. So for me, I'm a nurse practitioner. I have 2 nurses under me. So I have to lead my nurses and help them do their job. And I also have a clinical pharmacist with me. So I have to make sure that my team knows what they're doing so that we can successfully run the clinic together. So I want to backtrack a little bit so that we can talk about accommodation, because there's very different accommodations that we can get. With deaf and hard of hearing people, you have to remember that hearing loss is a spectrum. Okay, not every person with a hearing loss has the same hearing loss. I like to use my brother and I as an example. My brother is also hard of hearing. He has better hearing than me. So he can talk on the phone, he can do all that kind of stuff. Me, not so much. So my brother and I are very different in our communication style. We like different hearing aids. I like interpreters, he does not. So there's a very big difference in the same family. So it depends on the individual. So maybe you have a person with a mild hearing loss and they just need a note taker. Maybe you have someone that's fully deaf and they need an interpreter because they hear nothing. So you have to cater to the individual. It's not one size fits all. There's a lot of different options that you can pick for accommodation. So the first one would be the captioning. I really recommend the captioning in the classroom setting. I understand that some deaf people, English is not their first language, but the captioning is very valuable because it's fast. And the person listening is going to be talking very fast. And they're going to be spitting off all these terms and words that you don't know. And it would be easy to get it on paper because they can caption it and they send it to you after class and you can read it again. So that made all of my classmates jealous. They were always thinking that I was going to get the unfair advantage, but I always told them that I'm just trying to be at their level. Then we have a sign language interpreter. So I feel like the sign language interpreters and the cue speech and voice interpreters, you can put that in kind of the same category because some people like cue speech, some people like sign language, some people like voice interpreters. These are really helpful for the classes where you have moving parts. So maybe the skills lab where you're moving around and you need someone to move with you. So you'll just have to ask the student what they feel comfortable with. Maybe they don't want an interpreter at all. Then you can have note takers or scribes. A lot of times in the university they just hire a student that's in the class because they already know the vocabulary. So they try to find someone that's really good at taking notes to take notes for you. I think that these are probably the majority of accommodations. There's probably accommodations that I don't know about. So then we're going to move on to the real world. So obviously we can't have a cult person walk with me to every patient room trying to take notes with me. So we have to be more creative in the hospital. The first one on my list is the amplified stethoscope. I know everybody has a question about it. I'm going to say if you go to the AMPHL website, there's a table on that website with different stethoscopes and they compare them. So that's my best advice for you because I haven't tried all of them yet. And then I talked a lot about the work phone. So if the nurse works in a hospital, they work in a clinic or whatever, they're gonna have to carry some kind of a phone because you're gonna get phone calls from a doctor, you get phone calls from a pharmacy, you get phone calls from a lab. It seems like everybody's calling you all the time. So that person is gonna have to figure out what works for them as far as the phone. So for me, I found a way with IT to be able to forward the call from the clunky phone that they give you at the hospital to the smartphone to the app where it captions for me. And that worked for me. Some other Doppler hard of hearing people actually have asked their colleagues or other nurses to carry their phone and answer phone calls for you. If you're going to do it that way, you need to do some kind of exchange. So I've heard that one person, for example, they had the other nurse carry the phone for them, and they started all the ID for that nurse, had some kind of exchange. Or they put in all the catheters for that nurse, or they gave a medication for that nurse as kind of a trade-off. So you have to work with the hospital and work with the IT team and find a way that's going to work for you. Then when you're working at the hospital, it's noisy. There's a lot of noise everywhere. There's going to be alarms going off everywhere. It's going to annoy you. So the Doppler hard of hearing person has to figure out how they're going to see those alarms and how they're going to respond to the alarm. So for me, for example, my colleagues, they knew me well enough that they would just come up to me and say, hey, your patient in room 22, their ID is beeping again, can you go fix that? So that I would go fix that. Or sometimes the IT team can actually figure out how to link the alarm to your phone and send you a page so that you can get the page that there's an alarm going on. For the code blue, I think most hospitals, they'll have the announcement overhead, but then you also get a page. So if there's a code blue on the floor, then everybody on the floor usually gets a page. And it will say, code blue, room 22. And then you just go. The other thing, obviously, if you see a lot of people running, run with them. Just go with them. And then you'll figure out what's going on. And then communication with staff and patients. So the Doppler hard of hearing individual has to figure out what communication style works best for them. I like to talk face to face with my patient. So at the VA we use the clear mask, and my patient wears the clear mask. Some of my patients are actually hard of hearing, so I wear a clear mask for them, so we're both wearing clear masks. And we just talk face to face. Some people prefer writing stuff down. Some people prefer interpreters. Some people will use an app on their phone with the voice to text, where they can hold their phone next to the patient and they can read captions on their phone while the patient's talking. I have a friend in Texas that actually does that, and she says it works really well. So now we're going to talk about law, and it's not my favorite. But this case was actually mentioned yesterday in that wonderful talk. I actually know Lauren very well. She's a nurse practitioner up in New York, I think at the University of Rochester. And so Lauren, she was a nursing student at Johns Hopkins. She did very well in the school. They recommended for her to work at Johns Hopkins Hospital. So she went, she did an interview, she applied, I think they gave her the job, and she asked her interpreter. So this was like, remember how yesterday they were talking about the court cases where you go to court and the hospital kind of has to break down, like, that they did their research, they tried to figure out how they're going to provide the accommodation, they came up with a budget and all that kind of stuff, so they have to prove that it's unreasonable. So Johns Hopkins was saying that they couldn't afford interpreters. And so they were saying, I think the problem is the hospital is kind of weird because you have an overall hospital budget, but then every floor or every unit has their own budget. So I think a lot of hospitals expect that the floor and not the whole hospital will cover the budget for accommodation, when it should be the entire hospital covering the accommodation instead of forcing that floor to cover the accommodation. So I think that's kind of what went wrong in this court case, is the hospital was expecting the unit that Ms. Steele wanted to work on to cover the accommodation. And in order to get the interpreter, they were saying they would have to lay off 3 or 4 nurses to be able to afford to pay for the interpreter. So they went back and forth, and I think that Lauren eventually won the court case, and now she's a nurse practitioner and she's up at University of Rochester, very successful. So this is just one of many court cases. There's more court cases. They'll probably be talking about more court cases, I think, this afternoon. I noticed that they were talking about medical court cases, like medical school, but there's a lot of nursing school court cases. I actually was involved in a court case in Michigan as an expert witness because they were trying to say that this girl couldn't go to nursing school because she was deaf, and I was like, no, that's not the case. I'm a nurse. So there's a whole bunch of court cases that you can look up, community colleges and big colleges as well. So I'm just gonna wrap up. I put my email up here if anybody needs to contact me. I'm happy to answer questions anytime. I'm happy to help you with the program. I think we have about 4 minutes left, and if anybody has questions for me, I'm happy to take questions.